Hi, I'm Adrian Hernandez, a cardiologist at Duke and the director of the Duke Clinical Research Institute. I've been co-founding the CardioHealth Alliance with our partners at Stanford. So in 2019, we started noticing that there are problems in cardiovascular health. We started going backwards. We started seeing risk factors for cardiovascular health going the wrong way. We started seeing outcomes also going the wrong way. And so we started wondering what is possible to try to address this, to actually bend the curve back. And through our observations, we noticed that there are actually clinical leaders that are actually aimed to try to change this, but they actually don't have the data. They don't have the way to forecast or the radar to see where things are going. And we have people who actually are creating the data or actually curating the data, but noting that it's not being used. And then we also had these researchers that had all these grand ideas, but how do you bring all those things together was a challenge here. And so that was what formed the Cardio Health Alliance. Actually, how can we unite these different groups? How can we get clinical leaders, data scientists, researchers, implementation scientists together with other partners to so-called bend the curve back for cardiovascular health? As we form the Cardio Health Alliance, we recognize that there are these pillars that need to really support the Alliance and what we're doing. And so you can think of this as we have to have clinical leadership that's really going to enact what needs to change or transform healthcare. We have data that's being generated every day, and so we need to have data scientists to actually help us understand the data, identify the problems. And then we also have to have people thinking about implementation science or the research to actually address these problems and generate the answers that can be trusted in terms of how to transform healthcare. And then also a fourth one is actually thinking about how to make this really sustainable through changes in policy that can go across the US to take the lessons learned from the Alliance and turn them into impactful policies that everyone can use. So as we've been forming the Cardio Health Alliance, we're really excited about the programs that have already started. Key aspects of these is identifying a problem and characterizing it, and then be able to offer solutions and actually testing those solutions to see what works best, and also be able to scale that in a way that others can't. And so as we go forward, this model of co-creating solutions, tackling the problems that everyone agrees to, will be really important for our success and hopefully for others to emulate as well.